Estás viendo Canal América, televisión dominicana para el mundo.
A Time for True show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard, you don't know where to go. Everything keeps falling apart, yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome back to A Time for True show. I'm your host, Dr. Bernard Fialkoff, and tonight we really have a very special show for you. Because in life, sometimes it gets too artificial, or canned, or automatic. And we take things for granted that we shouldn't take for granted. But tonight we have a very special guest, and Buddha, if you start putting his pictures up, I want to introduce our viewers to someone who's a true definition of service. Albert Marcano, there you see his card, of dedication, of community leadership. That before anchoring his career in clinical medicine, he answered the call of duty, serving 6 proud years in the United States Army, 4 years active, 2 years in the reserves, serving the country. He's a brilliant alumnus of Hunter College, where he earned his Master's of Science, and he went on to dedicate 26 years in primary care at Elmhurst Hospital, while at the same time building his own thriving private practice in Jackson Heights, which he has successfully run in primary care for 12 years now. He's highly decorated and deeply respected, and he holds active memberships in the American Association of Nurse Practitioners, the American Association of Critical Care Nurses, and he was honored with a certificate of recognition from Downstate Medical Center for his outstanding commitment to precepting and mentoring. Really, if you meet him, you see how he really cares about you and dedication to really giving you what you came to see him for. When he's not saving lives, which seems like he's all the time that he's working, he's leading the community, and he's dedicated to his family. He's a married man and the proud father of 3 wonderful women. And we could go on and on and on. There you see him on the screen. Got a great smile. As a periodontal dental surgeon, I can tell you and certify that he does. And Buddha, let's bring him up live and bring a warm welcome to Albert Marcano to A Time for Truth show.
Thank you.
Welcome, sir.
I'm glad to be here.
Well, it's a pleasure to have you. Thank you for taking the time.
Thank you for asking me to come.
Oh, it's a pleasure, and you guys are just going to see why we invited him to the show. And I wanted to ask you, because before you got into healthcare, you were in the Army, and you experienced a lot of different things. And what I was really curious about, how did the experience, and also I would think that the extreme discipline, affect you in your life?
Well, it didn't affect me positively. It never, it helped me achieve, become the man that I am now. It also helped me stay focused. That's one of the things that I take out of being in the military for 6 years. Showed me how to focus, how to be accountable, and how never to give up and go forward.
Makes sense, because those are extreme situations, right?
Yes.
You were actually, you sent to where? You were in Iraq or?
I was in Iran.
Iran.
Back in '88. It was a short, it was a 2-month tour. A lot of my comrades, a lot of the soldiers didn't come back. So I was fortunate enough to make it back, and it just helped me become who I am now.
Absolutely. You know what? Sometimes we take things for granted, but an experience like that, I think, is life-changing.
Yes.
You know, and what I was going to ask you, those values and, you know, those experiences that you went through, how did that then, or how does that come out within your practice? Because I know you have a tremendously busy practice. And how do you feel that that comes out? What values do you utilize or you teach your staff to use to get the practice to go forward?
Well, it's all about accountability for me. It showed me how to work as a team in my practice, help my staff. Whenever there's a problem I don't look to see who to blame that problem on. I just get everybody together, focus on a solution, so keep everybody's trust in my practice and keep working as a team.
It's very interesting. You know, I was going to ask you a question because I see the way you are, and it just pops into my head. How were your mother and father? Were they like really tough people? Were they easygoing people? Or?
Oh, now you got into my mom was one of those old timers who she takes that whip out in a second. I'm back from the old school. My mom grew up. I'm Puerto Rican. My parents are both Puerto Rican, and I came from 7 siblings. So
big family.
So yeah, so my mom had little patience, but she was she did what she had to do, but we all came out 100%. All my whole family is graduated college, so we all have a career. So she did a great job. She did a great job.
And your father?
My father, I grew up with a stepdad. He was an electrician. He was always supportive. He raised me since I was 6 years old. And he thought of me as always his son. So
that's beautiful.
He guided me. I was also a boxer, amateur Golden Glove boxer.
Oh, you were?
Yeah, when I was 14 years old.
What weight class?
Heavyweight.
Oh, you were heavyweight?
Heavyweight already.
What, at 14?
At 14.
How much did you weigh?
Whatever, at that time it was like maybe 180 or something like that.
Wow.
I was a big kid. I was a big kid. But my stepfather was great. He was great with all of us. So I grew up in a great family. It was strict. Discipline was always there, but nowadays you can't discipline the way they used to discipline us, but we all turned out great.
Well, it's interesting because when I'm with you, it always comes out. And I wanted to ask you, this is kind of impromptu, because in the world, you get people out there and they want to be the general, or they want to be the macho guy, or they want to be the woman that tells everybody what to do. And you have a certain demeanor that you carry yourself with that I've seen in a lot of athletes, whether they're men or women, who have accomplished. And there's something, I don't know, there's something like that they're not interested in destroying anything. And there's like a calmness about you. So I wanted to ask you about that, because I've seen that in you, that like there's a focus, but you've got like this, like if you were in a boxing ring, like you probably like only box the guy so you wouldn't hurt him or something. Is that my imagination, or just?
No, that's the way I am. I'm low key, and the lower the stress, the better for me. I don't like stressful situations. If things happen, I know how to deal with them, but I'm always calm, never raise my voice at anybody at work or at home. I always, why this happened? Let's change it. Let's fix it. And I don't. Even though I came from a family who was very disciplined and a lot of yelling, a lot of things, but I learned from that.
Interesting.
I want to always become better. So
Well, I hand that to you because I've seen that since the very time I met you, that you're focused like a laser, yet you're very relaxed like a Buddha. And no matter, I could see something explode here, and you go, okay, let's see, what are we going to do now? You know what, why don't we call up the fire department and get them to come in? But, that's you, right?
Yeah, that's me. Even though when I was I was a registered nurse at Mount Sinai Hospital.
Yes.
And I was ACLS instructor, advanced cardiac life support. And whenever there was a cold on any of the floors, we had to rush. I would rush to the site, but when it came down to CPR, I didn't like no screaming. I said, let's do it by the book. 1, 2, 3. I've seen other people, new interns that go crazy. No, I just steady. If it happens, it happens. But I'm always like that. Since you've seen me, how I act, I'm always low key.
Absolutely. I've seen that about you, and I give you a lot of credit. And I want to ask you is, because you were 26 years in a major hospital setting, and then you have 12 years in this very intimate, practice with people. And how did all that, how does that influence the way you take care of people at Marcano Healthcare?
In Marcano Healthcare, for me, the difference between a hospital setting and a private setting, the hospital setting, there's a lot of rules, a lot of protocols that you have to follow. In my primary office, I like to listen to the patients. I like for them to take part in their care plan. Those are some of the things that I like my private office much better. Which everything that I learned from the hospital, I brought into my private practice, but I made it all more personalized to each patient and give them time. Let them talk about all their problems. That's the one thing I like about primary care. I don't have to rush.
You take your time, and you give them time so they can feel comfortable.
Yes, and they tell me that time and time again. Oh, you're so much different. I'm able to speak. You're not a 5-minute visit that wants me to come out. You let me, and that's why I get a lot of referrals. The whole family comes, the patient. I become the PCP of the whole family.
It's your demeanor.
Yes.
That makes a lot of sense. In the world today, we have so many things that we have, so many material things, technical advances. But you're right. I think one of the things we're losing in our world is what you're talking about, this humanity. I was going to ask you, so when a new patient comes in to your office, what is like your core guiding principle or premise that you want them to feel when they come into Marcano Health?
I want them to feel like they're coming into their own living room. I want them to feel like they belong there. I want them to feel, I want to reduce their anxiety. A respectful staff is the key. That's what I like to see when patients come into my office, that we release their fears.
When they're there as patients.
Yeah.
So it makes a lot of sense. And because we're in New York, and you and I are both Latin. I'm Cuban, you're Puerto Rican, and So we have all these Latin American viewers are going to be watching us, even though we're speaking English on the show. Es verdad, somos hispanos. You know, we'll put the closed captions for this show. And what are the major medical problems that you see in your practice that it's like the majority of the time?
Well, the majority of the patients, especially my office is in a very busy area in Roosevelt Avenue in Jackson Heights, Queens. And there's tons and tons of food trucks, Mexican food trucks and Ecuadorian food trucks, and they're always packed all day, all night. So the most of the people who come in my office, I either have high blood pressure. Most of them are pre-diabetic, or a lot of them are already diabetics. And the cholesterols the LDLs are sky high. Those are the three main diagnoses I would give the patients when they come into my office.
Uh-huh. Wow. And so, you know, that's what I was going to ask you. People talk about preventative medicine, right? Preventative medical care. What is preventative medicine? How would you quantify preventative medicine?
Is the steps that you take to prevent diseases. You know, like there's primary, secondary, tertiary preventions, but the ones that I like to focus on is teaching them when a patient comes in and I know they have hypertension or diabetes. I ask them, what did you eat last night? What did you have for breakfast? I always encourage them. Diet is one of the most important things. A smoker, I ask them, you had any cigarettes today? Those are one of the big things that you should try to stop smoking. Secondary prevention is, making sure, encourage them, did you get your mammogram? Did you get your pap? Did you do your colonoscopy? Those are the secondary preventions that I like to focus on. And tertiary, of course, if the patient comes, their blood pressure is out of control, bring them back every couple of weeks, every third week, increasing their dose, education. Those are the key preventions that I deal with in my office.
Makes a lot of sense. And so dealing with patients, and I mean, we're in New York, and, I think people in New York are a special breed of people, because New York is a very energetic place, a lot of opportunity, but a lot of people come here who are the top of their fields, different countries. What do you find are like the 2 or 3 major changes that you like to impact on them? Or what kind of lifestyle changes within your patients do you try to make them aware of? I mean, do you feel like maybe in New York that we have a certain mindset, and that in your practice you tend to try and do a certain path, or you try to get them to wake up to something? What is it that you find you recommend to them to try and get them out of that habit, those habitual patterns, like you said, of those trucks that are out there with a high, fat diets? And
of course, I encourage them to light exercises. That always helps out with many health problems. I show them different food choices that they can make, because since I'm Latino, I can help them, or I always refer them to a dietitian. If they have the diagnosis, any of the 3 diagnoses, I always refer all of them to a dietitian. Encourage them to keep going. That will help them a lot with their diet. Exercise and diet.
Those are the main things then.
Those are the 2 main things that I'm always on top of them with that, because it does help tremendously. These killers, these are silent killers. So they need to know, and I always stress that to them. You might not feel nothing right now. You come in with a blood pressure of 180 over 120, and you have no signs and symptoms.
Right.
At any moment you can have a stroke, have an MI. So I always encourage them.
Try to wake them up.
Try to wake them up. Push them.
That makes a lot of sense, right?
Yeah, sometimes I have to scold them, and then they listen.
They do.
Yeah, they do.
That must be. I got to see that. I've never seen you in that mode. But
Yeah.
How is your staff? How did you like? What kind of staff do you like to have around you? How do you pick your staff? You know, because
I pick my staff. I always pick licensed medical assistants. I have a director. She's also a registered nurse. That helps a lot. That helps with the teaching of the diet and the blood pressure. My staff contains 5 medical assistants and the director and a security guard.
yeah, you need those, right?
I need those in Roosevelt.
Absolutely. Well, I think everywhere in the world now. You know, you won an award from Downstate, which is, you know, congratulations. And you know, so you were mentoring, you preceptor, and you for these young healthcare practitioners. And what are the principles that you would like to pass down to these budding health practitioners before they go out in the world?
One of the important things that I see a lot, listening skills. You have to listen. Stop looking at your computer, stop looking at your phone, look at the patient. You don't know how countless times when I precept and the student is talking to the patient but looking at the computer, trying to speed up.
Multitask.
They're multitask. And sometimes the patient wants you to look at them. You gotta show humility also. If you don't know something, tell the patient, look, I don't know that right now, but I'll look into it and I'll get right back to you. To show them that, you know, you don't think you're Mr. Know-it-all.
Honesty.
You know, honesty. That's
missing in our world, right?
Yeah, you gotta be honest. That's one of the key things I like anybody who's on precepting for them to take out of that.
It totally makes sense because you know, you look at what's going on in our world and you look at some of the things that have gone on and since COVID also and how things have changed, and you know, you wonder, well, what would have happened if we had some more integrity back then? How would it have changed? And you know, the other thing I was going to ask you, because you have a training and experience in critical care, how do you translate that then into your practice and what you do with your patients? Having had that experience, you know, with critical care, how do you manage those early warning signs of high blood pressure, diabetes?
One thing I like to focus on, especially in my Latin community, when a patient comes in and they have high blood pressure, I like to give them frequent follow-ups. Come check your blood pressure, come to me every 2 or 3 weeks. Finger sticks for the diabetes, blood pressure check for the people with hypertension, and I like to stay on top of them. That way, that's one of the things, because I teach them also, as when I used to be in critical care, I see what happens at the end. I worked in so many ICUs and experienced patients' death, that I love to always educate the patients, frequent monitoring until we get to the goal that we're looking for. Then that's when I give them a longer appointment times.
Longer spaces, right?
Yeah, more spaces, yes.
That makes sense. And, you know, you're busy as anything. You're very productive in your practices. So I was going to ask you, because I know you're also very strong with your family. So how do you blend the two? And your wife has to be an unbelievable human being. And how does all that, like, how do you bring all those dynamics and integrate them all?
Well, I have to shout out to my wife, Amy Jane. I love you, honey. She is the pillar in my life. She takes away our stress. She was able to not work, take care of the 3 kids, and allow me to focus on our career.
A traditional mother.
You know, I bring home the money, and she takes care of everything else. When I come home, when I'm highly a little bit stressed out at work, as soon as I open those doors, everything goes away. To see my kids and my wife, so she's like number one for me.
It's beautiful. You know, the role of the woman is very important.
Very, very, very.
Right?
Yes.
I think in our society, I think one of the reasons we've been having problems is like what you were alluding to, is that we're missing that role. And so that, you know, we don't have it in our homes anymore. No,
I see so many people fighting, patients coming in and having issues with their spouse and all that. I'm so blessed. I'm so blessed, you know. So shout out again to my wife.
Absolutely. Well, you know what? Thank you for taking care of this guy, because he takes care of so many people, and it wouldn't have happened without you. So, absolutely. You said Mary Jane, right?
Amy Jane.
Amy Jane. Amy Jane, thank you for what you're doing and for being such a wife, good mother, good woman, good example for the world. And so, you know, as we get to the end of the show, I'm so happy we had you, and I wanted to ask you something, because you're a father, you're a patriot, you're a healthcare practitioner, entrepreneur, you love taking care of people, you're humanitarian. So what message from Al Marcano's heart, you know, this guy who was welterweight when you were young, heavyweight, you know, what message do you want to give to those people out there?
I mean, stay focused, follow your dreams, stay dedicated, stay committed to your goals, your wishes. That's what I got to say to everybody out there. I know there's a lot of nurse practitioners who want to open up their own practice. Go for it. Go for it. That's what I can tell. Go for it.
Beautiful. Well, you know what? Thanks for being on the show.
Oh, thanks for having me.
It's a pleasure.
It's a pleasure.
And you know, for you watching, I think we got a lot to learn, a lot to gain in his demeanor and the energy level. I'm sure you felt the energy level coming across. It's obvious to me why he has so many patients in his practice. And if you need a good nurse practitioner, Marcano Healthcare, and it's Jackson Heights, right?
Jackson Heights, 93rd and Jackson Heights, Roosevelt.
There you go. So you can reach out to him. We hope you enjoyed the show. But more important, let's implement his suggestions. Let's have a better life. And we'll see you on the next episode of A Time for Truth show. Enjoy the week.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. Let your feet